Today we're making a delicious kidney-friendly dish that's easy, packed with flavor, and great for your health. I'm Chef Jeffrey Held, and welcome to Cooking for Wellness. We're roasting a whole cauliflower with a smoky roasted pepper romesco and fresh herbs. It's crispy, tender, and absolutely mouthwatering. And since it's National Kidney Health Month, we have a very special guest, Dr. Robert Montgomery, Chair of Surgery and Director of the NYU Langone Transplant Institute. Dr. Montgomery, welcome to Cooking for Wellness.
Thank you.
So excited to have you.
Well, it's great to be here.
All right, let's dive right in. So today we're roasting whole cauliflower, super nutritious, loaded with fiber, low in sodium, making it perfect for kidney health. Sound good?
Looks beautiful.
So first thing we're gonna do is we're gonna preheat our oven to 425 degrees. If you have a convection oven where you have air circulation, that's the best possible situation. We do have that here, so we get a lot of leeway in that. So we're gonna prepare our spice mix. Wanna do the honors?
Sure.
We have 2 teaspoons of coriander seed. You can just add that to the bowl.
Okay.
We have 2 teaspoons of turmeric powder.
Okay. Love that.
Yeah. 2 teaspoons of cumin.
Cumin.
We have some garlic powder.
I'm a huge garlic fan.
Dried oregano. Fresh cracked black pepper.
Okay. All very healthy stuff.
Yeah, we actually also have
Oh, wow. This looks like something valuable.
some saffron. It smells absolutely wonderful.
Okay. It's beautiful.
And just a little bit of sea salt. We're trying to keep the salt to a minimum today.
So you can see very little salt.
And then drizzle in the olive oil. As soon as that's fine, as long as they're together.
Yep.
I'm gonna go ahead and prep the cauliflower. Just gonna cut out the core so it can sit evenly. So Dr. Montgomery, we always hear about how diet is so intricate with heart health and weight management, but how important is it for overall kidney health?
So the top 3 causes of kidney disease are high blood pressure, diabetes, and obesity. All very much influenced by diet, right? And so diet is, kind of that nexus between both heart health and kidney health.
So a huge part is actually theoretically controllable.
Yes, very much so.
So we're gonna start with our first 20 to 30 upside down. Into the oven we go.
Excellent.
We roasted off 2 red bell peppers. Can you just give me a hand pulling the skin off of these guys? So that's gonna be the base of our sauce, is the roasted pepper. We got a little bit of sun-dried tomato. So we got some raw garlic, just a couple of cloves. I'm just gonna crush it with my hand. We toasted the almonds, just 325 degrees for about 10, 12 minutes. Nothing on them, just raw. We got a 1/4 cup of tahini, a little bit of smoked paprika, tiny bit of maple syrup for a sweetener, so we don't use any silly sugars. Put that right in. Sherry vinegar.
I'm gonna rinse my hands.
Yep. Just a little bit of black pepper and a pinch of salt. So let me ask you a question.
Sure.
Do you get to speak to patients about their diet?
They know that I've had a transplant.
Yeah.
So they'll frequently, ask me like firsthand, knowledge.
Yeah.
Most important thing is if you stick to fresh foods like this and things that are not processed, you're going to be in pretty good shape. If you shop on the outside, on the perimeter of the grocery store, most of that stuff is going to be good. You don't go into the middle because that's all processed food.
I mean, that's
It's a good rule of thumb.
more or less the inspiration, the basis for this recipe. So we're just literally blending this up. We don't want it to be super smooth. I actually like a little chunky and rustic. And once it gets homogeneous and it seems to have joined a little bit, we can add our olive oil.
All right.
So, Dr. Montgomery, I mean, you mentioned before you were a transplant patient yourself.
I rarely use salt, but I always taste the food first. You see people all the time ask for the salt immediately. They haven't even
Nah, drives me
tasted it, right?
crazy. That's my job. Come on.
Yeah.
It's like an insult to me when you grab the salt.
So that's why I'm so excited about this, because you're doing all of this and creating, very flavorful food without salt.
Oh, Dr. Montgomery, I also heard you have a farm.
I do. Yeah.
Like a real farm, like working farm.
It's mostly wooded, but we've got several pastures. I planted about 200 fruit trees, and I have an orchard.
Orchard.
Yeah,
Apples
I'm
and
about
pears, or
everything you can think of.
Wow.
Yeah.
So, Dr. Montgomery, I gotta ask you now. I've been reading about you in the news like every day. What's the latest
What's up? What's going on?
fascinating situation in this transplants world?
What we've been doing is using gene-edited organs from pigs and transplanting them into humans. And we just did one about 2.5 months ago, and the lady's doing
Here.
beautifully. Here, yeah, we've done a number of them. We did the first one in 2001 in the world.
Wow. Look at that color. Very hot.
Gorgeous.
Be careful.
Gorgeous.
Look at that. See that caramelization?
Yeah.
All right, so ready to cut this guy open?
Okay.
All right, let's do this first. We have our sauce.
So you're gonna put the sauce. Can I take a quick taste of the sauce?
Do it.
Oh wow. So you do the smear.
Yeah. All right, I'm gonna cut it.
Okay, I'm paying a lot of attention to your cutting. Right?
It's definitely still quite warm.
Mmm. Wow.
So,
Can I have another little taste here?
of course, I got some toasted almonds. Add a little more crunch and a little more plant protein there. Just some fresh parsley
Oh,
and chives,
wow.
and that's it.
It's so good. I'm gonna make this.
Oh, you liking it?
I love
Okay.
it. Can I stay a little longer and eat some more of this?
Yeah, absolutely. Please check out more episodes on the Cooking for Wellness playlist.